Self-care advice for individuals with chronic constipation. First of all, drink approximately 2 liters of clean water per day, or about 8 glasses daily. In individuals without underlying conditions that require fluid restriction, such as chronic heart failure and advanced kidney disease. Consume 20 to 30 grams of dietary fiber per day to help increase stool bulk, soften the stool, and stimulate colonic motility, thereby improving bowel movement frequency. It is advisable to increase fiber intake gradually and ensure adequate hydration to prevent bloating during the initial period. Consume fermented milk, yogurts, or products containing beneficial probiotic strains, such as Lactobacillus or Bifidobacterium, which are usually indicated on the product label. These can help improve the gut microbial environment, soften stools, and promote intestinal motility, thereby increasing bowel movement frequency. However, if diarrhea or abdominal discomfort occurs, discontinue use. For individuals who regularly consume tea or coffee, it is advisable to reduce or avoid tea consumption, as tea may contribute to constipation. In contrast, consuming coffee with an appropriate amount of caffeine may help improve bowel movements, as coffee can stimulate contractions of the distal colon. Engaging in aerobic exercise, such as brisk walking, running, jumping rope, cycling, aerobic dancing, or swimming for at least 30 minutes per session, at least 3 times per week, can help alleviate constipation. It is advisable to establish a regular bowel routine, such as attempting to defecate after waking up, after meals rich in dietary fiber, after consuming coffee, or following exercise. In addition, one should go to the toilet whenever there is an urge to defecate, as this coincides with the natural period of strong colonic contractions, which facilitates bowel movements. Avoid delaying defecation when the urge arises, as prolonged retention allows the colon to reabsorb water from the stool, making it harder and more difficult to pass. While defecating, sit with your knees slightly apart. When you feel the urge to pass stool, hold your breath and lean your upper body forward, resting both elbows on your knees. Then, gently and steadily bear down while keeping your abdominal wall pushed outward throughout the effort. Continue bearing down until you reach the maximum effort with the abdominal wall fully expanded, and maintain this pressure for about 20 seconds for each attempt. For individuals who habitually use their fingers to stimulate bowel movements by inserting them into the rectum, this practice should be discontinued. Such manipulation can cause injury to the rectal lining, increasing the risk of bleeding and scarring, which may lead to narrowing of the rectum and further aggravate constipation. For individuals who perform large volume colon irrigation on themselves, for example 500 to 3,000 milliliters or more, this practice should be stopped. Such procedures can cause bowel perforation and severe infections, which may be life-threatening. If you have underlying medical conditions and need to take regular medications, inform your doctor of your conditions and a list of your current medications. Some medications can cause constipation, including opioid painkillers, NSAIDs, antispasmodic drugs, H1 antihistamines, antihypertensives such as calcium channel blockers, furosemide, atenolol or clonidine, antiemetics such as H3 receptor antagonists such as ondansetron, cation-containing medications, for example, aluminum, calcium, iron, bismuth, or lithium. Parkinson's disease medications such as dopamine agonists, Antidepressants including tricyclic antidepressants or monoamine oxidase inhibitors, antipsychotics, and certain chemotherapy agents such as vinca alkaloids or cyclophosphamide. If you experience anxiety or depression, you should find ways to relax and consult your doctor. For individuals with chronic constipation caused by improper defecation, dyssynergic defecation, who are undergoing anorectal biofeedback therapy, it is important to practice abdominal muscle breathing, diaphragmatic breathing exercises before starting defecation training. Inhale slowly, allowing the abdomen to expand fully without raising the chest. Then exhale completely until the abdomen is flat. Briefly hold your breath and repeat the process. Practice this breathing technique for 15 minutes per session, 3 times daily. This strengthens the muscles controlling defecation and enhances the effectiveness of the defecation training. Lastly, for individuals who need to use laxatives long-term, consult your doctor or pharmacist for guidance in selecting medications that are both effective and safe.